What if one small daily change, something you can do tonight, could make your nights quieter and your days more comfortable after 60? I'm Dr. Julia Morgan. For the last 15 years, I've treated men with the same complaint: frequent trips to the bathroom, poor sleep, and that nagging sense that their prostate is out of control. The truth I keep telling patients is this: age changes your body, but age is not destiny. 5 simple habits, done consistently, can reduce the irritation and pressure around the prostate and often lead to measurable improvement in weeks to months. Before we get into the 5 habits, if this video is speaking to you, hit like and tell me in the comments how many times you wake up at night to urinate. That helps me know where you're at and what to focus on next. Let me make one thing clear up front. This is practical, evidence-informed advice. Studies suggest lifestyle factors, movement, alcohol, diet, body fat, and bladder behavior are linked to prostate and urinary symptoms. Observational research from different countries has found associations. Clinical practice shows many men do get better when they change these daily patterns. I'll mention a few study cues as we go, but I'll never promise a guaranteed cure. If you have sudden severe pain, blood in the urine, fever, or inability to pass urine, seek care right away. This video is educational, not a substitute for a clinical exam. Think of the prostate like a sponge sitting under a small bucket, the bladder. When the bucket fills and you hold it, the weight presses down on the sponge. If that sponge is already a little swollen, that pressure causes irritation, squeezes tiny blood vessels, and makes the sponge stiffer. Over years, sitting, excess belly fat, alcohol, and holding urine can make that sponge more inflamed and less flexible. The result: more urgency, more frequency, weaker stream, trouble sleeping. Change the pressure and the inflammation, and the sponge often softens. That's the simple physiological idea behind these 5 habits: reduce pressure, improve circulation, and calm inflammation. Habit number 5. Walk 30 minutes every day, or 3 times 10 minutes. Why it helps: gentle, regular walking improves pelvic circulation, stimulates the muscles around the bladder and prostate, lowers systemic inflammation, and helps burn the belly fat that contributes to hormonal imbalance. Think of blood flow as plumbing for that sponge. Better flow clears inflammatory signals and brings healing nutrients. How to do it: aim for 1 continuous 30-minute walk or 3 brisk 10-minute walks spaced across a day, whatever you'll stick to. A brisk walk means you can talk, but you'd struggle to sing. If mobility is an issue, start with 10 minutes and add a minute or 2 each day. Walking after meals is particularly helpful for blood sugar control and digestion. Evidence and vignette. Observational studies, including work cited in the British Journal of Sports Medicine, show physical activity is associated with lower urinary symptoms and improved quality of life. In my clinic, I saw Mr. H, a 67-year-old retiree from Florida who complained of waking up 3 to 4 times nightly. He started walking 20-30 minutes most days. Within 6 weeks, he reported fewer nighttime trips and better daytime energy. His symptoms didn't vanish overnight, but the change was consistent and noticeable. Practical tip to start tonight: put on your shoes after dinner and walk 10 minutes around the block. Tell yourself you'll add another 10 minutes tomorrow. Small, consistent steps beat dramatic but unsustainable efforts. Many hook. This one is easy, but most men don't do it. The next habit is harder for many, and it's about something people enjoy: alcohol. Habit 4. Limit alcohol to 3 drinks per week or fewer. Why it helps: alcohol is bladder irritating and can worsen urgency and frequency. It also affects hormone balance and sleep quality. Even moderate drinking can relax the bladder muscle in ways that make nighttime trips more likely. If you're drinking several evenings a week, reducing intake often produces quick symptom relief. How to do it: define 1 or 2 alcohol-free days per week, reduce serving size, and keep a weekly limit. Aim for no more than 3 standard drinks per week. Substitute with sparkling water, herbal tea, or flavored seltzer in social settings. If you're used to evening drinks, replace the ritual. Try a short walk after dinner or a hobby that keeps your hands busy. Evidence and vignette. Population studies, including cohorts like those discussed in lifestyle research from Japan and Western cohorts, link higher alcohol consumption to worse urinary symptoms and sleep disruption. I remember a patient in Boston who cut his habitual 4 to 5 drinks per week pattern down to 2. Within 2 weeks, he noticed fewer urgent sensations and a deeper sleep. Again, not a guaranteed fix for everyone, but a change many men notice quickly. Practical tip to start tonight. If you usually have a nightcap, skip it once this week and replace it with a non-alcoholic drink. Observe how you sleep. Mini hook. Diet matters too. And there's one colorful food I always recommend. It feels too simple to be true, but it has a biochemical reason. Habit 3. Eat cooked tomatoes at least 3 times a week. Lycopene with healthy fat. Why it helps. Cooked tomatoes are rich in lycopene, a carotenoid with antioxidant properties. Lycopene becomes more absorbable when tomatoes are cooked and combined with a little healthy fat, like olive oil. Antioxidants may reduce oxidative stress and inflammation in tissues, including the prostate. Eating tomatoes won't erase advanced disease, but regular servings are associated in observational studies with better prostate markers and lower inflammation. How to do it. Include a cooked tomato serving. For example, half a cup of tomato sauce, 1 cup of stewed tomatoes, or a tomato-based soup, at least 3 times a week. Pair with a bit of olive oil or use cooked tomatoes in an omelet, pasta, or a vegetable stew. Canned tomatoes are fine. Choose low-sodium options if you're watching blood pressure. Evidence and vignette. Some epidemiological work and cohort research, including perspectives from larger studies, suggest a link between lycopene-rich diets and better prostate outcomes over time. I had a patient from Melbourne who began adding tomato sauce twice weekly to his meals. After a few months, his lab markers were stable and his nighttime frequency decreased by 1 to 2 trips. Remember, this is part of a larger pattern, not a magic bullet. Practical trip to start tonight. Open a can of stewed tomatoes and add them to scrambled eggs or a quick pasta. Aim for at least 1 cooked tomato serving this week. Mini hook. Now we get to the habits that change the hormonal and mechanical environment most, and they require consistent attention. Habit number 2. Aim to lose about 10% of body weight if you're overweight. Focus on belly fat. Why it helps. Belly fat is metabolically active. It raises inflammatory molecules, alters insulin and estrogen levels, and contributes to pelvic pressure. Carrying excess weight around the midsection can make the prostate environment more inflamed and less responsive. Losing modest weight, even 5 to 10% of your body weight, often reduces urinary symptoms, improves circulation, and enhances overall energy and mobility. How to do it. Combine small, sustainable dietary changes with movement. Simple strategies that work. Reduce portion sizes, use a smaller plate, cut back on refined carbohydrates and sugary drinks, and replace snacks with whole food options like nuts, vegetables, or Greek yogurt. Pair this with the walking habit. Focus on slow, steady weight loss. About 0.5 to 1 pound per week is sustainable. Evidence and vignette. Large cohort studies, including analyses from major public health research groups, show higher body mass index and central adipocity associate with worse urinary symptoms. In practice, I treated a man from Chicago who lost 12 pounds over 3 months by cutting sugary beverages and walking regularly. He reported stronger urine flow and fewer episodes of urgency. Those lifestyle changes also lowered his blood pressure and improved his sense of well-being. Practical tip to start tonight. Trim just 1 portion from your usual dinner. For example, use half the pasta portion, add a big salad, or replace dessert with fruit. Combine that with a 10-minute evening walk. Mini hook. The last habit is the one I consider the most immediate and underappreciated, and it's something you can implement tonight with 0 cost. Habit number 1. Don't hold your urine. Respond promptly to the urge, the 5-minute rule. Why it helps. Holding urine stretches the bladder and increases pressure on the prostate. Over time, repeated holding trains the bladder to become overactive and the prostate tissue to stay irritated. Think back to the sponge analogy. If you press on a sponge repeatedly and keep it compressed, it gets stiffer. Letting the bladder fill to extreme levels also compresses pelvic circulation and increases inflammation. Responding to the urge promptly helps break the cycle of pressure and irritation. How to do it? When you feel the need, aim to empty within about 5 minutes if it's practical and safe to do so. Plan your day. Schedule short bathroom breaks rather than waiting through long meetings or TV binges. If you're on a long drive, plan stops. For social situations, excuse yourself briefly rather than holding on. Keep a small notebook or use your phone to track times you delay. Awareness is the first step. Evidence and vignette. Clinical observations and physiology explain why repeated holding worsens symptoms. Japanese lifestyle studies and urology clinics report associations between bladder behavior and symptom severity. A patient from Toronto told me he habitually held urine during long working days. He changed that pattern, aimed for regular breaks, and within weeks his urgency decreased and he reported fewer urgent leaks. That kind of progress is common when men consciously stop holding. Practical tip to start tonight. If you often hold when watching TV, set a gentle alarm or use program breaks as cues to stand and use the bathroom. Make it automatic. Bathroom when the show goes to commercial or between episodes. Putting it together. How these habits work as a system. Each habit targets a different but related lever. Movement improves pelvic circulation and reduces inflammation. Cutting alcohol removes a direct bladder irritant and improves sleep. Cooked tomatoes add antioxidant support. Weight loss lowers inflammatory hormones and mechanical pressure. And responding promptly to the urge stops the mechanical cycle of compression. Together, they reduce pressure, improve blood flow, and calm inflammation. The 3 core biological levers affecting prostate comfort. Start small and be consistent. Pick one habit tonight. Add the next one in a week. In clinical practice, men who adopt 1 or 2 changes often begin noticing improvements in a few weeks. More robust changes typically take 2 to 3 months. Everyone is different. Factors like age, baseline health, medications, and the underlying cause of symptoms matter. These habits support many men, but they are not a replacement for evaluation when needed. Common questions I hear. Will this shrink an enlarged prostate? Lifestyle changes can reduce inflammation and improve symptoms, but they don't always physically shrink the gland. Some men feel much better even without a large change in prostate size. Can supplements help? I don't recommend specific supplements here. Evidence varies and products are inconsistent. Focus on whole foods and proven lifestyle patterns first. What if I'm already on medication? These habits complement standard care. Don't stop prescribed treatments without talking to your doctor. Safety and important red flags. This video is educational. If you experience severe pain, fever, shaking chills, visible blood in the urine, sudden inability to urinate, or any new, rapidly worsening symptoms, seek medical attention promptly. If you're starting a new exercise program and have significant heart disease or mobility limitations, check with your clinician about safe activity levels. These 5 habits are generally safe and low risk, but individual medical conditions may require tailored advice. A few final practical tips to make change stick. Pair habits. Combine walking with portion control. Walk after meals. Use cooked tomatoes as a simple swap for a processed sauce. Replace an evening drink with a short walk to break patterns. Track progress. Keep a simple log of nightly voids, alcohol units, and walking minutes. Seeing small wins motivates further change. Consistency over intensity. 10 minutes a few times daily beats a single long session you soon abandon. Support. Involved a partner, friend, or caregiver. Accountability helps adherence. Before I close, one brief evidence reminder. Observational research from various cohorts, including Japanese lifestyle work, analyses published in journals like the British Journal of Sports Medicine, and long-term cohort studies consistently show links between activity, body weight, alcohol, diet, bladder habits, and urinary symptoms. These studies suggest associations rather than guaranteed cause-effect for everyone, but combined with clinical experience, they form a practical roadmap many men benefit from. Choose one habit to start tonight. If you want the simplest first action, respond to your next urge. Don't hold it. If you want a slightly more active start, go for a 10-minute walk after dinner. Comment below which habit you'll try first and how many times you wake up nightly. I read those comments and they help shape future videos. If this helped, subscribe for more practical, evidence-based tips for men over 60. You don't have to accept restless nights or constant urgency as inevitable. Small daily choices add up. I'll see you in the next video.